I'm Wendy Garner for Children's of Alabama. Today we're talking about antibiotics and their overuse. Joining me right now is Dr. Shannon Ross, who handles infectious diseases here at Children's. So good to see you.
Thank you.
There's definitely a time when antibiotics are necessary, right? Explain a little bit about that.
Right, so antibiotics treat bacterial infections, and bacterial infections typically are what causes a pneumonia or an ear infection, and those are necessary to treat those infections.
In fact, it can be life-saving.
Life-saving, yes, absolutely. We know antibiotics will save lives. However, most of the time when children get sick, it's due to a virus, and viruses are not treated by antibiotics. They really are not effective at all.
And so what you're seeing more and more is resistance to the antibiotics because they're being used when they don't need to be. Is that correct?
Exactly. We are seeing over the past decade or so increasing resistant common infections, pneumonias, bladder infections that we used to be easily treat are now becoming resistant to common antibiotics. And we know that antibiotic overuse and inappropriate use of antibiotics is what causes antibiotic resistance.
And that can be scary. It could end up in a child being hospitalized.
Yes, we see children now every day who 10 years ago, 5 years ago, we could have treated with an oral antibiotic, but because there's not many options, we have to admit them and give them IV antibiotics. So it's really changed things.
It's very serious. So we as parents, what can we do?
Parents are very important to help with this problem. So when you take your child to the physician when they're feeling ill, it's important to talk to your physician about the diagnosis. If your physician prescribes an antibiotic, it's okay to ask them specifically what the antibiotic is for and is it necessary. And then if you are given an antibiotic, the important thing is to use it appropriately as prescribed.
Don't skip a dose, right?
Exactly. Don't skip a dose. Take it for the prescribed course, and really one of the most important things is don't give antibiotics to your child that were prescribed for someone else.
Very important. And so some really good important tips for you to keep your child safe in the long run. But just a reminder, if your child has a cold, then they don't need antibiotics. If you're going to give them any medicine, it would be more symptom relief.
Correct? Right. Okay. They just have to sort of ride it out. And your physician can help, with that discussion about that.
But that's better for them in the long run.
Absolutely.
All right, Dr. Shannon Ross, thank you so much for sharing some important tips with us. And if you'd like to learn more about this or other health and safety related topics, just go to our website, childrensal.org.